Good afternoon, everybody. My name is Dustin Strong, and this is our Ask Me Anything Hour. This is where we answer the questions that you've submitted to us over the week when it comes to your health and wellness, all kinds of aspects of health, and we are going to jump right in because we have a whole bunch of them. We've been reviewing the documentary Game Changers a little bit by little bit, so I'm going to drop a little in here on this time, but we have so many questions, so I'm not going to get too deep into it. I'm going to start out with natural pain relief after surgery. It's a number one question we have coming in here. And when you think about pain, most approaches to reduction of pain is reduction in inflammation. So one of the things that I tell people about that may be outside of what people are normally thinking about is something called chlorophyll, but chlorophyll in a fat-soluble format. This is a really important distinction. Actually, in early World War II, they were using chlorophyll to help accelerate wound healing. It's very healing in a lot of ways, so post-surgery would be one of the number one things I would bring in, but a fat-soluble chlorophyll, which is very different than a water-soluble. Water-soluble is not how it occurs in nature, so they have to treat it with copper to be able to make it water-soluble. And we actually have a whole sheet here in the office about how to use chlorophyll pearls that are fat-soluble to help with that. There's a lot of aspects to it, so there's a lot to know about it. Chlorophyll's amazing, by the way. When you think about how molecularly similar it is to our own blood. It's actually so similar, it's just a difference between an iron ion and a magnesium ion, and the rest of it's almost molecularly identical. So chlorophyll. And the next question we have is, what can I do for pain and discomfort years after neck and spinal surgery? So again, I'm going to go back to talking about inflammation, because inflammation is going to play into that pain again. And one of the things that I would pair with that chlorophyll would be a really good turmeric. And to my knowledge, to my experience, the best turmeric that I know of is MediHerb's Turmeric Forte because of how that they prepare it. They blend it with fenugreek seeds, so it makes it much more available and it doesn't have the negative effects of having a black pepper in there. So the combination of those two, I've seen many, many times be a game changer in inflammation and pain in people. And when you look at things like tumor necrosis factor and people trying to use medications like things like Humira and whatnot to help reduce that, you can go to the National Institutes of Health and you can see that there's a lot of research also supporting what's happening with the turmeric and helping reduce these different aspects of inflammation and pain. Now, there are many, 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 many things that are driving pain, so the more we can understand what is the driver of the inflammation, the better you can support your body's ability to resolve it. But if we're doing buckshot on that, chlorophyll pearls and turmeric forte are going to be my number one and number two starting in both of those categories. I hope that's really helpful for you that are out there struggling with pain and inflammation. Oh, and I should probably mention removal of anything that's going to be pro-inflammatory. So things like refined sugars and carbohydrates and alcohol, and high omega-6 foods like commercially produced eggs and things like that. So you want to reduce things that are going to increase your inflammation, of course, if you're trying to resolve inflammation, because you don't want somebody pouring fuel on a fire that you're trying to put out at the same time. Okay. We have a miracle of the week, actually, so this is fun. We have a doctor who comes to see us here and asking and learning more about nutrition, and she wanted to share with all of us some exciting news because we've been a part of the health journey. She had an appointment with her internal medicine doctor, and her A1C is now down to 6.1. So she's now out of diabetic diagnosis and just in pre-diabetic. So you do have a control on how you can change that. So remember that. That's probably one of the most impactful things that you can impact the most with your diet and exercise. This Friday at 6:30 at the Far Best Theater in Mansfield, we're going to be delivering a free public talk to the community about Healthy This Way. And one of the things we're going to be talking about is the EPIC study. And the EPIC study followed around 23,000 people for 8 years, and they showed just by changing 4 things, they reduced the incidence of diabetes by over 93%. This is a massive change. So you have a lot more control than you think about when it comes to those things. So stay encouraged, and anybody you know out there who's struggling with blood sugar balancing issues, please share this information with them. Let them know there's a lot that they can do. Okay. We have a question, should you eat breakfast before working out in the morning, or is an empty stomach okay? Excellent, excellent question. And honestly, I can't tell you, in the last week I've had at least 5 people tell me, hey, I've tried going and working out without eating something first, and I actually enjoyed the workout more. I felt more energetic. I felt better about it. And I'll give you 2 reasons why I would always work out on a fasted stomach, on an empty stomach. Number 1, as soon as you eat, you want to be in a rest and digest state. What do they tell you before swimming? If you eat, you have to wait, what? Half an hour, whatever, to go swimming, because your body's in digestion. You don't want to put it into fight or flight and digestion at the same time. It's gonna have to choose. And once you start working out, you go into fight or flight, so your body's gonna stop digesting that. I would say you wanna give your body at least an hour and a half after eating something so you can get to that point and go work out, and you're not working out with food in your stomach. And the other thing is if you're eating, say, like a banana or something before working out, you're just gonna be burning up that sugar from the banana, and your whole purpose is you're trying to burn fat. You're trying to get into that state. When you're working out fasted, you're burning up your glycogen stores, and if you can get into ketosis, then you're burning the fat. So I would definitely encourage people to think about trying to work out without that. Now, if you have blood sugar balancing issues or problems like that, make sure that you're giving yourself a little support, but be careful of that. But the number one thing that I would do personally for somebody who's healthy is to choose to eat a workout on an empty stomach. Okay, I would say it's definitely okay. The last question is ghee butter better for you than butter? Okay, is ghee better for you than butter? Okay, so ghee is clarified butter, and what does that mean? Clarification of the butter removes things like lactose, which is the sugar. It removes any protein that could be in there, so it is truly just the fat. And so for that reason, ghee is superior to butter, because there are a lot of people who have sensitivities to the dairy proteins, to the dairy sugars, and if you can eliminate those and just get the clarified butter, a lot of times people have a much easier time digesting it because it's less competitive in the different enzymes that have to come out to be able to process it. So for many reasons, yes, I think ghee is a fantastic choice, and I would choose it whenever the option comes. Okay. A couple announcements here. Number one, if you're enjoying these, please share these videos. Let people know that there's a medium out there that you can send questions to and get a different perspective on, or at least give you some hope on something, help you find the next right thing that you can do. And many people ask about the content and questions that we've had before, so you can search the history of these videos here, but we also started transferring all of these over to our YouTube channel, the Strong and Health YouTube channel. So if you do get a chance, go check that out. You can do some searching by category, and please do subscribe to the YouTube channel so that we can keep giving you more and more content in there and an easy way for you to find it. Again, Healthy This Way is happening, guys, so help us make it happen. This Friday is going to be a great event. We're going to be talking a lot about the things that you can do to encourage and support yourself and your whole community to be as healthy as possible. And okay, so game changers, I'm all over the place. Game changers, quick thing about that is, yes, it is definitely highly pushing people towards a plant-based diet. And this is the one thing that I've always kind of presented to people asking me about vegetarianism versus being a meat eater. And what I say to vegetarians is, if you're a vegetarian, make sure that you're eating vegetables. That's what it means to be a vegetarian. I know too many vegetarians who will go get vegan donuts, and all that would be is sugar and bread. There's no vegetables represented in that except for maybe a portion of the wheat that's left in there. So a vegetarian means that you're actually eating whole foods. And this is the part that we forget to emphasize when we're talking about the whole food plant-based diet. They're focusing on plant-based. I'm focusing on whole foods. So the whole food portion of that is much more powerful than the plant-based. You want to make sure you're getting the whole plant. Too many people, as we would say, are donutarians. They say, well, I'm a vegetarian, but they're eating donuts, they're eating bagels, they're eating nothing but breads and refined carbohydrates, refined sugars, refined carbs, the things that are damaging to you. So just becoming a vegetarian does not make you healthy. You have to still eat the whole food part of that. Okay, and finally, I want to end on, I actually had a conversation with my 13-year-old nephew this weekend, and it was really encouraging to see someone receiving health information without having all of the misinformation dumped into their brain for decades. So they were able to open up and kind of really receive what we were talking about. And we were talking about how your body is made up of amino acids, and amino acids coming from proteins, and how all of your cells have a phospholipid bilayer, meaning that there's fat around them. So your body has essential fats that needs to build itself. It has essential amino acids to build itself, but there are no essential carbohydrates. So many people come to me and ask me, saying, hey, but don't you have to have carbohydrates? Don't you have to have those for fuel, for sugar? Your body can take proteins to make fuel out of it. Your body can take fat and make fuel out of it. So just keep that in your brain when you're thinking about what is actually essential for your health and what isn't. And this finally leads me to the last thing. And as we go into the holidays, we have a lot of people who start to struggle with challenges in depression, quite honestly. And this has been a question that actually my nephew asked me. He actually said to me, what's the most challenging thing that you find when you're helping people? And I told him it was working with people who are starting to struggle with their mood, who are having low mood, not able to enjoy life, because there are so many things that contribute to that. It can't be just one thing that you're going to rule out and all of a sudden you're going to be happy again. So all of next month we're going to be dedicating to giving you information to rule out all of these things that could be contributing to low mood for all of those people who struggle during the holidays. So if you have questions about that specifically, next month, this month, or from now until the end of the year is now the time to start bringing those questions in, because we want to give you all the support we can to keep you happy and keep you enjoying life and helping you understand that there's a lot that you can do to keep yourself out of the blues and into that zone where you start to feel lonely and like you don't have any help. So we're here to help you. Keep those questions coming in. Thank you guys for supporting us and thank you for watching, and we'll see you guys on Thursday in the next video.